Hi, this is Debbie Roman, and joining me today is Dr. Stephen Fekete, and welcome to In the Know at Cummins, and we will be talking about our medical services here at Cummins, so thank you, Dr. Fekete, for joining me today.
Oh, you're welcome. It's actually my pleasure to be here with you to talk about medical services. I don't get a chance to do that very often in such a format.
Oh, well, great. I'm glad you're here to join me today. So, how about we start off by saying what is medical services?
Well, medical services is that part of Cummins that is involved with prescribing medications, initiating or starting medicines, and then overseeing how effective those medications are for a given individual, whether they're adults, youth, or children.
Okay. So, why would someone be referred to medical services?
Well, there are a few reasons why somebody would come into medical services. The two biggest reasons why are that somebody who's already getting therapy and or skills, they have reached the maximum benefit of that and their treatment is kind of stalled, or they're not feeling like they're getting any more improvement, and then we may be referred over for to see if medications would be of assistance for that individual in helping them deal with whatever problem brought them to Cummins. The second reason is that somebody may already be coming into Cummins as a new patient or a new individual, and they're already on medications and they're asked to continue them. But I actually, as I was talking about it, thought about another one. The other reason would be that somebody who's experiencing an addiction who needs medications to help them with their addiction, and that's a little different than the other two, whereas this is just where the other one may be to help when they stall in their other treatment format, as I referenced in the first one. The medications for addictions or medication-assisted treatment is there right at the onset to help them right at the beginning to be able to deal with the problems that brought them in, their addiction or substance use problem.
Okay. Great. So why is it important, and how would someone benefit from being in med services?
Well, it's important because we provide a service in Cummins. Well, Cummins provides us services that's more comprehensive, where we don't feel that just therapy alone, or just skills alone, or just medicine alone is generally going to get you where you want to be. We believe in more of like the best practices, that a combination of these type of approaches would be beneficial for the person and help them achieve their goals and remission of their symptoms quicker than just one of them alone. So like for instance, we just don't do med services alone, which is kind of called naked pharmacology if you want to. We don't do that because medicines are just not the end all. And although we do encourage people that if somebody can come in and do therapy only or skills only, we don't do medical only. So it is there. So our service is there to help that person achieve remission of their symptoms or their problems or deal with their issues in the quickest way possible with that. And the other thing is we do a number of other services, which I hope we will be able to talk about here in a few minutes, that can help that individual in their life and their wellness and mental health.
Well, on that note, so what other than prescribing medications, what other services are provided in med services?
Well, when somebody comes into med services, of course they will see a prescriber, which could be a doctor or an advanced practice nurse, and they get a thorough questioning, I guess, or they get an evaluation where we go over their medical history. And that part of going over their medical history, we ascertain whether or not there is need for a doctor, like a medical doctor, whether or not a dietitian would be indicated, whether or not they need to see a dentist, etc., etc. So we can be a gateway for people to get other services because it's not that other clinicians can't do it, it's just that it's a medical thing, and I think we're a little more familiar with the language and we can get people in maybe a little quicker, all right? And then we're able to tell why we're doing that referral, and that language and being able to communicate that to another provider, like another medical provider. For instance, we'd be able to say something like, well, this person has hypercholesterolemia, elevated cholesterol, and they need to be seen for that, and that gives us that advantage. The other thing we do is, of course, we do vitals on everybody, which is looking at weight, blood pressure, pulse, and just monitoring their overall well-being, not only for their medications, but also just to help them in their physical health. When we also, out of that, can do counseling ourselves, even though we don't have to refer somebody out for like dietary work. We can do some of that counseling. We can help people with smoking cessation. So we are mental health, psychiatry, but we're all doctors, we're all medical, so we can address all the other medical needs, or at least get somebody to the place they need to be that have that medical need taken care of. So in addition to doing the medications, we have medical assistants who help out at the beginning of every appointment in taking vitals that I've mentioned, but we also have a service called My Health Nursing, and that is an individual that helps individuals that come here for treatment, they're nurses, to address any medical needs that may be interfering with their ability to achieve their mental wellness. And it's a set of skills and therapies and counseling. And of course, along with that, although it's implied to us, I want people to know that we routinely educate people about medications and where they can go to get other information about the medicines that have been prescribed.
Okay, great. So, how would Med Services enhance treatment?
Well, what comes to mind is I've already talked about sort of if somebody's kind of hit a roadblock and they're not progressing the degree that they want to, that we can be that stepping stone that allow people to get to whatever goals or achieve whatever they would like to as part of their treatment. So that's really a main part of it. The other things that we can do is, of course, the medical part that we talked about. But I think the important thing is, in addition to those, another important thing, is that we're another set of individuals or faces that can interface with somebody and be there to provide support. So it extends the treatment team. And when you put more minds together and working with a given individual, the better the care is, because there's more ideas, more people at the table that can help that individual, and it allows for that person to outreach to many other different individuals. Because sometimes it's very important that no matter what size the team is, that sometimes people just hook up with one particular caregiver, whether it's a therapist, skills, or nurse, whatever, and they have a really strong relationship with them, and that is a conduit for a lot of information. And so the more opportunities you give people for that, the better off they'll do in their treatment.
Okay, great. So what advice would you give someone who's hesitant about starting services here?
Well, there are a couple of different things. We can do, of course, we work generally through the therapist and or the clinician, including the skills person, and the peer support person. I don't want to leave that group out, it's just as important. That they can come to us and say this person is hesitant for X, Y, and Z reasons, and we can counsel them or give them advice on how to address that problem with that given individual. Now, sometimes we've done this in the youth, where somebody wants to come in and just get more information about medications, like an adult. The parent will come in, they're hesitant, and so you can sit down and say, you can give general information, right? So somebody like ADHD and the use of Ritalin is a common question that comes up, or families are hesitant. You can schedule an appointment with that individual or that family member and then just sit down and talk about how Ritalin fits into a whole group of medications to treat ADHD, or what are the common side effects and how to manage them, and what the chances are of a medication working for a given individual with that. So there's a way, if you want to allow people to actually speak to a prescriber without making a commitment.
Mm-hmm.
But I think another point with regard to that issue is that when somebody gets started in medicines, they come to a psychiatric evaluation. Nobody's under an obligation to take a medicine that's been prescribed to them. These are recommendations, but only they can make that decision to take them. And it's the same with youth. Only the parent can say yes or no whether or not somebody takes the medicine. You can stop a medication at any time. It's always good to get our advice on how to do it. But it's not a lifetime. I think a lot of people are concerned that once I start a medicine, I got to stay on it for my life, and then I become dependent on it. And I think you just have to address those kind of myths about medication. But I always counsel people and say, look, you don't necessarily have to make up your mind at this appointment. You can go home and talk about it. If you start it, you change your mind, that's fine. Just let us know. And if you have any problems, just give us a call as well.
Thank you for joining me today, Dr. Fekete. And if you would like any more information about our medical services or any other services that we offer here at Cummins Behavior Health, just give us a call at 888-714-1927 or check us out on the web at cumminsbhs.org. Thank you.
Bye.